Hello students, my name is Alok Simwal and in today's lecture I am going to talk about introduction and classification of antihypertensive agents. So before starting antihypertensive agents, we have to understand what is hypertension. Hypertension is also known as high blood pressure. It is a long-term medical condition in which blood pressure in the arteries is persistently elevated. Blood pressure is the force of blood pushing against the wall of arteries as your heart pumps out blood into the arteries. Its level varies with age, sex, level of physical activity, and emotional changes. Hypertension refers to the sustained elevation of blood pressure above normal range. According to the World Health Organization, hypertension is defined as systolic or diastolic pressure persistently higher than 140 or 90 mmHg. Risk factors of hypertension include increasing age, family history, overweight, and smoking. Sometimes high blood pressure may also be caused by certain medicines or diseases such as kidney or endocrine diseases. Next is disease etiology. Etiology is the cause, set of causes, or manner of causation of a disease or condition. Hypertension is of two types: primary hypertension and secondary hypertension. Primary hypertension is the elevation in blood pressure without an identified cause. Secondary hypertension is the elevation in blood pressure with an exact cause. This type is account for 5 to 10% of total cases. The cause of this type of hypertension include congenital narrowing of aorta, renal diseases, endocrine disorders, neurological disorders, sleep apnea, medications like contraceptive pills, non-steroidal anti-inflammatory drugs, cocaine, and cirrhosis of liver. Risk factors associated with hypertension are age, alcohol, smoking, diabetes mellitus, excessive dietary intake of sodium, gender, family history, obesity, and stress. Management of hypertension is possible by two ways: lifestyle modification and pharmacological management. Lifestyle modification include weight reduction, DASH diet, dietary sodium intake, reduce alcohol, exercise, stress management, etc. DASH diet is dietary approaches to stop hypertension. Second, pharmacological management include various groups of drugs used in the treatment of hypertension, which are collectively called as antihypertensive drugs. So antihypertensives are a class of drugs that are used to treat hypertension, which is high blood pressure condition. Antihypertensives therapy seeks to prevent the complications of high blood pressure such as stroke and myocardial infarction. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A myocardial infarction, also known as heart attack, it occurs when blood flow decreases or stops to a part of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort which may travel into the shoulder, arm, back, neck, or jaw. Classification of antihypertensive drugs include several categories. These categories are diuretics, alpha blockers, beta blockers, calcium channel blockers, vasodilators, angiotensin converting enzyme inhibitors, and symptolytic drugs. Diuretics helps in the kidney to inhibit the sodium reabsorption in the distal convoluted tubules, ascending limb, and loop of Henle. Alpha blockers causes the peripheral vasodilation of blood vessels. Beta blockers reduces the workload of the heart and blood vessels and causing the heart to beat slowly and with less force. Calcium channel blockers will block the movement of extracellular calcium into the cells and causing vasodilation and decreased heart rate. Vasodilators. These medications act directly on the muscles in the wall of arteries and prevent the muscles from tightening and arteries from narrowing. Angiotensin converting enzyme inhibitors. This group of medication will reduce the conversion of angiotensin first to angiotensin second and prevents vasoconstriction. Last category is of symptolytic drugs. Symptolytic drugs are agents that decrease the activity of the sympathetic nervous system. In this classification, marked drugs are included in the PCI syllabus. Thank you.